name is Kenyatta Stevens, and I'm a student at Columbus State University, as well as a fellow registered nurse here at Grady Memorial Hospital. I've asked you all to join me today so that I may present to you a national patient safety goal initiated by the Joint Commission. The goal in which I will be presenting to you is preventing CLABSIs in a hospital settings. CLABSIs, as we know them, are central line acquired bloodstream infections. CLABSIs are usually acquired when a patient has had an insertion of a CVC, which is a central venous catheter. Central lines are a very big part of modern day healthcare. They are mostly used when peripheral access is unavailable or cannot be obtained. They are mainly used to administer IV fluids, blood products, medications, parenteral nutrition, and they are also used in those patients that receive hemodialysis as well as hemodynamic monitoring. They are heavily associated with bloodstream infections, so this causes a big risk for our patients. Microorganisms somehow gets on the external surface of the device and flow through the bloodstream of the patient. The usage of central lines increases morbidity, mortality, and hospital care costs. The Joint Commission has initiated a prevent infection safety goal to prevent our patients from acquiring these central line bloodstream infections during hospitalization. Preventing such infections can decrease morbidity, mortality, prolonged stays, and decrease the cost spent by the hospital. Ensuring positive patient outcomes involves us being aware of culture and safety, collaborating with the different teams that are here on the floor. It also states that if the healthcare team is familiar with the procedures, the correct procedures I should say, we can prevent our patients from acquiring these central line bloodstream infections. The risk factors that are in place for CLABSIs are as follows: the patient's age, the underlying disease or conditions, the patient's gender. There are also modifiable risks, which includes prolonged hospitalization before a central line has been inserted, multiple central line accesses, giving a patient parenteral nutrition, the particular site that a patient has received the central line, multi-lumen central lines. As we know, we can have double lumen or triple lumen central lines. The lack of sterile barriers that takes place when a patient is being prepared to have a central line inserted. Last but not least, the area in which a central line is placed, such as the emergency room or the ICU. So I provided here a case scenario in which a patient received a central line and ended up with an infection. So a 27-year-old patient comes in and is admitted to the medical ICU from another hospital that has alcohol-induced pancreatitis. Upon admission, an abdominal CT showed severe pancreatitis with pancreatic inflammatory changes. The patient is ventilator dependent, requiring a tracheostomy, and has vascular catheters in place. He has a catheter in the right subclavian and the right internal jugular vein. On ultrasound, an ultrasound-guided aspiration of pancreatic fluid revealed a negative bacterial culture. CT was repeated on the abdomen that revealed unchanged pancreatitis, but interval development of fluid collection in the abdomen. Later, the patient is taken to surgery for pancreatic debridement, and the patient spikes a temperature of 102 degrees Fahrenheit. The right IJ line was discontinued, and the catheter tip and blood specimen were cultured. 2 days later, the culture resulted that the pancreatic fluid had no bacterial growth, but the catheter tip had growth on the tip, and the blood culture was also positive. Given that scenario, the patient had definitely acquired a CLABSI because the blood cultures were positive for a pathogen and there was no evidence of infection at any other site other than where the central line was placed. In order for us to prevent CLABSIs in a hospital setting, there are a few things that we need to do as a team. We must be educated and trained on the floor about central lines. We must practice proper hygiene. We must use central venous catheter bundle insertions, and we must maintain aseptic techniques. According to the Joint Commission, staff should be trained to insert and maintain central venous catheters. Even in hospitals where their resources are poor, they have found that basic education has helped decrease CLABSIs in the particular setting. All healthcare personnel who insert and maintain central lines should be knowledgeable and competent regarding care related to preventing CLABSIs. The staff must remain current on technological advances in the prevention of CLABSIs in order for our patients to have positive outcomes. The key elements of CLABSI education program should include appropriate indications for CVC insertion, best practices for the insertion, and appropriate care and maintenance measures. With proper hand hygiene, there was a study that showed that proper hand hygiene yield a decrease in CLABSI rates. The study was performed in a 27-bed unit, adult cardiovascular ICU at Mission Hospital in California. All of the study data that was collected from a single ICU beginning in December of 2009 and ending in February 2012. The mean monthly CLABSI rate decreased from 1.1 to 0.5 per 1,000 catheter days. During the study protocol, there were 0 CLABSIs for 9 months. So that study alone, it shows us that using proper hand hygiene, washing our hands before we touch our patient, washing our hands after we touch our patients, can decrease the chances of our patient receiving a CLABSI. Another study that yield decrease in CLABSIs was the CVC insertion bundle. The bundle included the type of catheter used, the insertion site, the sterile barrier area, and using PPE. This study was conducted in 5 adult ICUs at a regional teaching hospital, which had 63 ICU beds and 8 intensivists. All the data that was collected through March 2013 through December 2013. The rate of CLABSIs significantly declined. So we know that if we choose the correct catheter type, if we choose the correct insertion site, which would be best if used in the internal jugular versus the femoral, we can decrease CAUTIS for our patients. A third study that we all must use is CVC maintenance and aseptic techniques. The study showed that proper maintenance and aseptic techniques decrease the rates of CLABSIs using bundles for central catheter maintenance. The bundle protocol included education on that particular protocol using alcohol-based central catheter tips, and those are used for the hubs of your central line. So if you're not using a line on your patient, then you want to make sure that they are covered with those alcohol caps so that no bacteria is introduced. You also want to use chlorhexidine dressings. You want to make sure that the skin is prepped. You want to make sure that your dressing is clean and that it is changed in the proper amount of time. You also want to use a central team of nurses who comes around and demonstrates, clean techniques, make sure the dressing is changed for our patients. And if we do this regularly, then we can definitely decrease the chances of our patients acquiring a CLABSI. So, now that I have shared those prevention techniques that you and I should use to make sure that our patients have positive outcomes when it comes to bloodstream infections, I want everyone to keep in mind that clean hands equals clean patient. So, if you have any questions, my name is Kenyatta Stevens. I'm available for any questions after the presentation. Thank you.